last question that I wanted to just think through with you both is I had, she's probably 70, African American woman who came in and had been on hormone therapy historically. She'd been off of it maybe a year or so because she'd ended up having some heart palpitations. That took her to the emergency room. She was admitted because of her age. She doesn't actually have any structural heart problems. She has high blood pressure. Get her high blood pressure fixed and it goes back normal. But when she came to me anyway, no one would put her back on hormone therapy because of her age. And so she and I did some risk benefit analysis and whatnot. But I'm curious, do you see that happen in your practice too, where somebody's been on it for years and for whatever reason they're taken off, but now consider the risk is just too high magically? How do you work through that in your mind?
Yeah. So there's a difference between starting someone who hasn't been on hormones for 20 years, starting them at age 70, versus
Mhm.
someone who's been on hormones since they were 50.
Mhm.
There's a huge difference in that. And I see this happen a lot where someone will have been on hormones for a while and then maybe their doctor retires, they get a new doctor, and that new doctor says, I'm not refilling these. And so they get off them. And then they're so frustrated because they don't feel good. They have hot flashes that they haven't had for 20 years, and they want to go back on. And so, of course, you have to look at the big picture, the risk benefit analysis. But if they're otherwise healthy and have been doing well for a long time on hormones, and like you said, her heart ended up being fine, I would probably put her back on hormones. So then the question is, how long is too long? And we don't have that answer, right? Like, is it a year and a half versus 5 years? We don't have that answer. Maybe we will one day, but we just don't know.
Mhm.